A newborn pain assessment is definitely different than an adult pain assessment. In adults, you can ask, how much pain are you feeling? Rate it for me on a scale of 1 to 10. You're not really able to do that with a newborn. So you have to look at how the newborn's behaving to kind of tell you if they're in pain or not. There are a few different scales that are out there that are useful to help you determine whether the baby is in pain. These are mostly, a lot of them are listed in my live binder, so you're welcome to kind of take a look at more in depth. But most of them kind of look at the facial expression. Is the baby crying? What's their tone? What's their vital signs? Increased vital signs can sometimes mean a baby's in pain. It can also mean that they might need their diaper changed, and there's a lot of other reasons that could be causing it, but that sometimes can be one, especially when it's coupled with other stuff that's going on. If they're grimacing, if they're waking constantly, all of those things can indicate that the baby is in some sort of discomfort. Then you have to determine whether it's pain that's causing this discomfort or if it's something else. So if they do have a wet diaper or if there's something else that's causing them to feel uncomfortable. So a lot of the time, if you don't have a reason to believe that the baby's necessarily in pain, they're not post-operative, there's, not something specific going on, you'll make sure that they have a clean diaper, that there's not something pressing into their skin, that they're not hungry, because all of those things can make babies irritable. Those are all things that you'd want to keep in mind. In terms of treating pain, there's a lot of different options. There's also some non-pharmacological options that are used for newborns. Sucrose is something that is used in the newborn period for painful procedures especially. So if the patient needed an IV or something like that, you can use sucrose, and it helps decrease the pain that the baby experiences during that procedure. It's relatively short acting, and it's not an actual medicine that they're getting, so it's not like they're getting morphine. It's just sugar water, but it does seem to work for infants and is commonly used in the hospital for them. You also can do some nutritive sucking, so they could, breastfeed if they're in pain or uncomfortable, and the hormones and stuff that they get from the breast milk can help calm them down. Also, the experience of being close to mom can also help calm them down, so that all has a very, positive, beneficial effect on the newborn.